Hi, everyone, and welcome this evening. Thank you for joining us for tonight's Integrative Therapies and Nutrition webinar. Tonight's session focuses on self-care strategies for managing nausea. Before we get started and I introduce our speakers, I'd like to just go over a couple of housekeeping items. Just so everyone knows, you are in listen-only mode. That is to minimize any audio distractions. But we do welcome your questions, and we'll have time at the end of the session for Q&A. So if there is something you would like to ask, you can click on the chat icon at the bottom of the screen. Only myself and the presenters will be able to see your question. The session is being recorded, and it will be posted to the Cancer Center website, should you like to watch it again, or for anyone who may have missed it. And lastly, we just ask that you don't share any personal medical information or questions in the chat box. If you do have a medical question, please ask your doctor. I'd like to introduce our speakers for this evening. Mary Tricoli is an oncology infusion nurse and a Catherine A. Gallagher integrative therapy staff acupuncturist. She's been an oncology nurse for over 20 years and an acupuncturist for over 10 years. Prior to working at MGH as an acupuncturist, she completed a 1-year acupuncture fellowship for inpatient care at Beth Israel Department of Integrative Medicine in New York. And she enjoys introducing acupuncture and its health promoting benefits to her patients. And we have two dietitians with us this evening. Samantha Bateman is a board certified specialist in oncology nutrition. She's been in the Cancer Center for over a year and sees patients at the Boston campus, pediatric patients in the Proton Center, and patients as part of the Lifestyle Medicine Clinic. She completed her dietetic training at The Ohio State University and enjoys providing evidence-based medical nutrition therapy and support to her patients. Megan Carell is a clinical dietitian who joined the Cancer Center in November 2020. She sees patients at the Boston campus and also has experience working as an inpatient dietitian at Brigham and Women's Hospital. She completed her dietetic training at Bastyr University and is passionate about providing evidence-based nutrition recommendations to her patients. Thank you all so much for being here this evening, and I turn it over to you now.
Thank you so much, Devin. It's great to be here with everyone tonight. We'll be speaking to you about nutrition and acupressure. I'll be speaking first about acupressure. And before we start, the next slide will be about the National Cancer Institute's definitions of integrative, alternative, and complementary strategies for treating cancer symptoms. So the first one is alternative, and these are treatments that are used instead of standard treatments. For example, a special diet instead of cancer drugs as a treatment. Complementary are treatments that are used along with standard treatments. And then finally, integrative is a type of medical care that combines conventional standard treatment with complementary and alternative therapies. So this is what we have at the Mass General Cancer Center. We have an integrative therapies program that we use and integrate along with our medical care. So tonight we'll be speaking about nausea, and I wanted to just go over the different types of nausea that we do see. So with chemo, there can be acute nausea and delayed nausea. So with acute nausea, this is what we anticipate will happen on chemo day. So we always pre-medicate with medications like Zofran or a steroid like Decadron before chemo, anticipating that the body will have a response to nausea if we don't pre-medicate. So this is usually an expected part of chemo. There's some medications, some chemos that cause delayed nausea. So this is nausea that's going to develop after that first 24-hour period and can extend several days. There's certain platinum-based drugs that we anticipate this with, cisplatin, and then cyclophosphamide, which is another type of chemo, ifosfamide, and adriamycin. So these we know can have this delayed nausea effect. So we intentionally schedule anti-nausea medications for a few days after chemo. So it's really important, just as a side note, to always follow the prescribed scheduled anti-nausea medications. The next slide, we'll talk about some other types of nausea that tonight's strategies can be really helpful to treat. So we have breakthrough nausea. So this nausea is something that, despite the anti-nausea meds that have been prescribed, the patient will still experience some nausea. So we use either more pharmaceuticals, more anti-nausea meds, or try a multi-pronged approach, which would be trying acupressure or nutritional strategies to help with the breakthrough nausea. So tonight I'll go over some acupressure points that you can try for this type of nausea. And Sam and Meg will go over some nutritional strategies to help the body during this time. We know that chemo is going to affect fast growing cells, and the GI tract has fast growing cells. So we anticipate nausea with many of the chemotherapies that we give. This fourth type of nausea, anticipatory nausea, is not frequently seen, but sometimes patients who've had sort of a bad experience with poorly controlled nausea, they can have just almost like a reaction before they even get into the building, just that thought or the memory of chemo being something that was really unpleasant and they didn't feel well. So it's almost like the body's memory of the infusion triggers this reaction of nausea. So with this type of nausea, we often use Ativan, which is an anti-anxiety medication, but also acupressure can be very helpful to sort of just calm that response and calm the mind and the body to sort of help ease up that nausea. We also want to make sure we're very aggressively covering the nausea appropriately with medication. And with some patients, they can do very well with the standard medications. Other times we have to get more creative and add in other types of pharmaceuticals to help. Finally, radiation-induced nausea. This can often happen in patients receiving whole brain radiation that can actually cause a lot of nausea, as well as brain, upper abdominal, or head and neck radiation. So we anticipate that with those patients going through radiation. Okay, next slide, please. So here's a list of evidence-based complementary nursing interventions for the treatment of nausea. I've highlighted what we'll be talking about tonight, but you'll see there are several other interventions that have evidence-based for treating nausea. We have a list, I believe, that will be available in our notes for all the corresponding studies. Okay, next slide, please. So I'll be talking to you about acupressure. So acupressure is based on acupuncture. Acupressure is without using the needle or the pin to insert into the body. So there's no insertion with acupressure. It's just applied touch. So acupressure has its roots in East Asian traditional medicine. It's a technique of applying pressure on specific points on the body to elicit an effect. These points are stimulated and will either ease or create balance or homeostasis in the body. So the technique is pretty straightforward. You're finding the location, and then once you find it, we recommend holding pressure, some gentle to moderate pressure. You don't want to hurt yourself, over the point for about 2 to 3 minutes. Based on where the point is, you can either just hold it directly, and I'll be giving a demo also, or you can use a circular motion. I find for the dose of acupressure or the frequency for nausea, if we're treating nausea, we want to do it 30 minutes before meals and at bedtime or as needed during the day. So thinking about this and using it in a scheduled manner can be most beneficial. Okay, next slide, please. So this is pericardium 6. This is one of the kind of superstar points in acupuncture for nausea. So we call it the empirical point for nausea or really any upper GI issues. So including nausea, vomiting, hiccups, epigastric pain, which is pain below your ribs, abdominal distension, and fullness. It's a very well studied point, not only for chemo-induced nausea, but also for post-operative nausea. I have a C-band here, which is a little band that goes around the wrist. Oftentimes people use this for motion sickness on boats. You'll see people wearing this, or if they're flying. So this idea of the C-band is based on this point in acupuncture. So with this point, we want to find it on the inside of the forearm. And I don't know, Devin, if it's easy to do, if we can do a screen of for the demo, or if we can just continue along. But you're going to find the point on the forearm. It's going to be 3 of your fingers up from the wrist crease. So find your wrist crease and you put your 3 fingers. In acupuncture, everything's proportional to your body. So your finger size and your hand and arm size. And then at the bottom of that 3rd finger, between the 2 tendons, you'll find the point. What I do for my patients, if I'm helping them with acupressure at work, I'll take a Sharpie and just make note of the point so then they can easily find it. But once you find it a couple times, it's pretty straightforward. But also for patients that want to use the C-band, the same location to get your band up further, which I can show you with this. So it's not quite at the wrist, but a little ways up, like about 2 inches up from the wrist crease. Usually with this point and for other acupressure points, it's very safe, but we do want to let patients know if you have an IV or a PICC line or a Mediport in that arm, we don't recommend using any acupressure or acupuncture. So you can use the other arm. Both arms, if you want to rotate, if there's no limitations, you can do 2 minutes on each side, that's fine. But doing the gentle pressure for that period of time, 30 minutes before meals and then at bedtime can be very helpful for nausea. I think the other thing I wanted to say in regards to safety is that if patients have had a recent deep vein thrombosis, a DVT, you do want to avoid any acupressure for 21 days after starting your anticoagulant. So after your 3 weeks, if you've been on an anticoagulant for 3 weeks, then you're safe to have acupressure. So those are really the 2 safety pieces, just avoiding the arm with an IV, and then just being cautious if you've had a recent thrombus in your limb. And the next slide will be another very important acupuncture point, which is stomach 36, Zusan Li, which translates to 3-leg mile. Or 3-leg miles. This is a major point to harmonize the stomach and to treat all gastrointestinal issues. Again, nausea, vomiting, the epigastric pain, belching, hiccups, and it also treats diarrhea. So this actually treats a lower GI point, which is good to know. And even I'd say constipation. The way acupressure and acupuncture work, it's going to create homeostasis in the body. So by just pressing on the point and inactivating it, the body then does what it naturally will do to balance itself. So with this point here, we find that it's really helpful for patients, not only for nausea and GI issues, but it also can help with fatigue. And it's been in East Asian medicine, it's supposed to help build qi and blood, which is the energy of the body. That of course correlates with being able to digest food and eat well. So you'll gain energy from being able to tolerate food, which is really important. So with this point, we want to, we're going to find it on the leg. So I'm going to walk patients through it, but if you at home want to just, while you're seated, if you can find the point, I find it easiest if you're seated and your knees are at a 90-degree angle. You're going to just roll down your kneecap to the bottom of the kneecap, and then you'll find that there's a lot of bony area, but then you're going to take 4 of your finger widths and sort of just cap right underneath the kneecap. So say that's my kneecap, and I'm just going to just cap right underneath it, and then off to the side, away from the midline of the body, you're going to just slide into this almost like just a little divot there, and that's the point. That's stomach 36. So 4 fingers below the kneecap. It's in a depression between the shin bone, the tibia, and then the lateral leg muscle, the tibialis anterior muscle. It's another point where I will mark for patients, but once they get used to trying to locate it, they can find it pretty quickly. So this is a nice point to just do that circular massage with. And again, the dose can be the same. You could do it 30 minutes before meals and then again at bedtime. I think this point's really, you kind of get a little bit more bang for your buck with this point because it has that effect on the chi and the blood. So this can be a great point going through chemo. And the combination of using pericardium 6 and stomach 36 together is a really strong acupressure point prescription for patients that are experiencing nausea. Thank you. And now over to Sam.
So we'll move a little bit into the nutrition piece and talk about the negative side effects of nausea and vomiting. So aside from being very unpleasant, there can be some potentially significant negative impacts on overall health and treatment outcomes with persistent nausea and vomiting. So the main way that nausea and vomiting can impact treatment and health is through the reduction of appetite. So low appetite is commonly seen with patients that have nausea and vomiting. And when patients are experiencing this, it's more difficult to maintain adequate nutrition status and basically eat enough to make your calorie and protein needs met in addition to fluid and other micronutrients. So this puts potentially patients at risk for losing nutrition that's important for healing and recovery from treatment, especially that protein. It can also put patients at risk of dehydration. It's important to maintain adequate hydration, especially with chemo and radiation. So not getting enough fluid is potentially a detriment. And then risk of weight loss and malnutrition is a negative side effect of nausea and vomiting as well. So this can be seen easily with any sort of calorie deficit. We'd see a little weight loss, and that puts patients at risk of malnutrition. And then lastly, just an overall fatigue and interference with activities of daily life that previously were pretty easy and now are becoming more difficult as the nausea and vomiting become an issue. So next slide, please. So now we'll just talk about some of the strategies to help manage nausea. The first one is pretty self-explanatory. It's not going too long of a period on an empty stomach. We know that an empty stomach can exacerbate feelings of nausea. So we kind of aim to have a snack or a meal every 2 to 3 hours. And, you know, it can be something small like a cracker. It can be a meal, a snack. This can look like eating even 6 to 8 small meals or snacks a day. Just small, more frequent meals, which can also help with adequate intake of calories and protein, but especially can help, again, with just preventing long periods on an empty stomach. We also want to emphasize bland, easily digestible foods. So Sam will touch a little bit more on this, but it's basically choosing bland foods and avoiding things that are known irritants like fried or fatty foods, very sweet foods, very spicy foods. So those GI irritants, and kind of sticking to that brat diet. And then lastly, and I kind of like this one because it's not one that most people think of, but choosing foods that are room temperature or cold. Since they emit less odor, they can sometimes help to be a little less nauseating. So that might look like choosing a cold turkey sandwich instead of something like salmon and Brussels sprouts, say. So choosing foods that emit less odor can also help with nausea. Next slide, please. And then the last couple of tips. So one of them is staying upright for at least a little bit after eating. So, if you do have a snack or a meal, planning to sit and not lay down or nap, and then additionally not eating a meal or a snack too close to bedtime. So making sure you leave some room there so that you're staying upright after a meal. Additionally, and this one is really frequently used and really commonly something that we recommend, is using oral nutrition supplements such as a Boost or an Ensure or an Orgain when appetite is low. So again, just it's kind of easier sometimes to drink nutrition. These oral nutrition supplements don't emit a smell. They have a good amount of calories and protein and micronutrients in addition to, there's such a wide range now that can come and kind of medically serve the purpose of each individual patient. So these we'll recommend kind of in place of a meal or along with a meal or as one of those 6 to 8 eating opportunities when appetite is low and nausea is high. And then lastly, pretty much all of these recommendations are the same for vomiting, but there's one important one that I wanted to emphasize that's different, is that when we're experiencing vomiting, it's important to also make sure that we're replacing fluids and electrolytes lost if vomiting is happening. So that looks like choosing, Gatorades or Pedialyte, Noon tablets, liquid IV, things that will help to replenish and maintain good hydration and prevent dehydration.
So we will also be talking about nausea that is triggered by different smells. Megan kind of touched on this a little bit earlier, but for some people, even just the smallest smell, whether it's in the kitchen or around the house, can really trigger a queasiness or just an unsettling feeling in their stomach. So choosing meals that have a minimal smell while cooking, or just in general, can really help reducing the nausea or the queasiness that some people might feel. Or even removing yourself from the cooking area. Even if you have another level in your house or another room that you can remove yourself, kind of take a break, or even as the weather gets better, step outside while someone's cooking in the kitchen to just remove yourself from that situation to settle your stomach before mealtime. And again, Megan also kind of touched on this, choosing cold or room temperature foods, they do not smell as much as hot foods do. So even like cereal or a cold sandwich might be a little bit better than a hot sub or like fish or eggs or something like that. And then some liquids also have a pretty strong odor. I know a lot of my patients, they like the taste of Ensure and some of the oral nutrition supplements that are really important to help people meet their calorie and protein needs, but they may not like the smell as much. So even if you put that liquid that has a little bit of an odor that you don't really like into a cup with a straw and a lid, and try to minimize that smell as much as possible. That way you can get what you need, but not make yourself uncomfortable from the smell. And then just some other options if you are experiencing nausea from different smells. So choosing a cold sandwich over like a sub, cereal, or even toast with a little bit of peanut butter for some extra protein instead of eggs, if that's something that bothers you, or even like a smoothie that it doesn't really have any smell at all, with banana, some nut butter, some yogurt for a little bit extra protein too, instead of a large hot meal or breakfast or lunch or something like that. It's a little bit easier on the stomach. Next slide, please. And some great foods that can really help with nausea. I'm sure a lot of people have heard that ginger, it's very, very well studied in terms of nausea. Ginger itself you can use in cooking, but also ginger tea. And I personally like to recommend ginger chews or ginger candies just because they're a little bit less work involved. You can just kind of have them in your purse or in your pocket, whether it's during treatment or while you're out and about. Something you can suck on if you're just kind of having that breakthrough nausea that Mary kind of touched on earlier today. And then ginger ale. Ginger ale is great because of the carbonation that often settles a lot of people's stomachs. So the combination of the carbonation and the ginger can really help. Mint is one of those foods or flavors. It's not as well studied as ginger, but anecdotally, a lot of people have found some relief with peppermint, whether it's peppermint tea or even just the regular peppermint candies. Same idea as the ginger candies, keeping them by, in your purse or in your pocket so you can suck on those throughout the day. And then bland foods that don't have a lot of smell, don't have a lot of spice, they're not super greasy or fatty. These foods are easily digestible. They don't sit in your stomach for a long time, so it doesn't feel like that food isn't going anywhere. Because when you're nauseous, sometimes it just feels like whatever you're eating, it's not going anywhere, it's not moving. So toast, white rice, white pasta, mashed potatoes, even applesauce can be really good options. And then also lemon, whether it's used as a drink or even smelling lemon like aromatherapy, that can also have a settling effect on your stomach. And I know we said to stay away from fried and greasy foods, but the one exception is trying a small portion of potato chips or even a small portion of French fries. The combination of the sodium and potassium can actually really, really help nausea. So even if it's just a small handful, and you get a little bit more calories as well. So if you're struggling getting enough calories and protein in, even a small portion of potato chips can make a big difference with nausea. And some drinks, if food or if meals are really tough for you to eat or drink, there are some commercial options that you don't really have to do any work for. So Boost Soothe is one of the newer options on the market. They have two different flavors. These are both clear drinks, which might be a little bit more appetizing for those who are a little bit more queasy, a little bit more nauseous. So I have two options here. So we have peach mint. So that goes back to the mint flavor that can help settle your stomach, but also strawberry kiwi. Again, they're kind of like juice. So they have 10 grams of protein, which is pretty good for a clear beverage, and they have 300 calories. So that's really, really good bang for your buck in terms of nutrition, calories, and protein for a clear drink. And then one that's been on the market for a while and tastes delicious is the Ensure Clear. It's a little bit less calories, but it's great to get enough fluid in. And it can really settle your stomach because it's clear and it's not super heavy. And we have many supportive care services here at Mass General. So you can ask your provider, your nurse practitioner, medical oncologist for a referral for nutrition, as well as integrative therapy such as acupuncture, acupressure. Mary, any additions for the referral process on your end?
Well, I wanted to say, and this might come up in the questions, but because of COVID, we have had to change some of the ways we treat patients. So currently, we are only for integrative therapies for acupuncture and acupressure. We're treating patients that are coming in for their chemo or they're coming in for their radiation, so they're being actively treated. So for our patients that have finished completion of their treatment, we're offering telehealth acupressure. So that's one way to still stay connected to us and receive treatment over the phone, just guided acupressure. And I know it sounds like for nutrition, you guys.
It's very similar. Yeah, we are offering pretty much 100% telemedicine right now. Both over the phone and video visits are available.
Great. And just one more thing. So our services are for Mass General Cancer Center patients, but if we have other folks listening tonight or caregivers that are interested for their self or their loved ones, but they're being treated at an outside hospital, it'll be important for you to just reach out to your provider and see what's available in your community, in your hospital for these services, if there is something.
Thank you all so much for your presentations tonight. And just to add on to that, if you do want to check out this particular link here, this is where we have our supportive care calendar. So some of the other integrated therapy services, such as music therapy, yoga, some other educational workshops that we have that you can pop into that are being held right now, again, through Zoom. You can see the calendar listing here. And now we will turn to Q&A. So if there are any questions, I can present those to our speakers. You can type those into the questions box. We do have some time left. Mary, would you be able to show again the pressure point that was here?
Sure. Okay, so what I do to find it for the first time is really extend my palm upward to just engage the tendons in the upper arm, or in the forearm, I should say. And you're going to take 3 fingers from the wrist crease, so where the wrist bends, and then so it's my ring finger, where that 3rd finger lies, you're going to find the space between the 2 tendons. So I'm going to just remind myself my anatomy. It's tendon palmus longus and then flexor carpi radialis. So those are the 2. It's a delicate area. So actually, for when we're putting a pin in, we're very careful and gentle. But this is the point where I would just recommend holding pressure rather than doing the circular motion. The leg point I went over, you can definitely do the circular motion. It's a larger point. The leg point's about the size of a quarter. This point is pretty small, as you can see the space between the tendons. And some people have, the anatomy is a little bit different on everybody. Some of the tendons are very close together and very tight. So you still want to stay in that area. So just be really gentle with the pressure. So what I like to do is actually support the point with my thumb on the opposite side of my arm. And then I would relax my arm and then just hold it for those 2 to 3 minutes. And that would be considered a dose of acupressure. And again, using the Sharpie. So I've very slightly did a little X mark here tonight to show you, but I usually do with the marker at work for patients so it'll stay on after a shower or 2 until they become familiar with that point. And so it's just easy to find it and use it. And this is something, not only can you use it scheduled, but also, for anticipatory nausea, if you're coming in and you're in the car, someone's driving you in and you want to just do some acupressure and take a few deep breaths and sort of just connect with your body, but also have a benefit from this point. That's a nice practice. Or if you're about to have a CT scan or wherever you are, you can just access this point, which is really nice to have another tool in your toolbox, in addition to your anti-nausea meds, in addition to how you're eating. In Chinese medicine, we talk a lot about ginger. So there's definitely an overlap between East Asian medicine and Western nutrition with ginger, with the use of ginger. So hopefully that's helpful. And I think for the point on the leg, it's the same idea, but you have a little bit more room there just with the anatomy. There's it's a larger point, so you can really kind of get some nice pressure there. And you can actually feel some tenderness and achiness on the leg, where at the point on your arm, you don't really feel that connection, where with the leg, you can really feel that it can be tender or achy. So I think it's easier to find in that regard too. So just getting kind of used to that anatomy in your body and palpating that area, it's pretty easy to find once you identify it. and just gentle massage, 2 to 3 minutes, several times a day can be really beneficial.
Thank you, Mary. We have a couple of questions coming in. What is an easy source of ginger, lemon, and peppermint to keep handy?
Honestly, I think there are a lot different kinds of hard candies that are really easy to transport. So there's ginger flavored candies, lemon flavored candies, and peppermint. But you can also infuse water with all of these ingredients. So if you like having the fresh versions of lemon, even just not necessarily peppermint, but mint, and ginger, you can use a combination of all of them or use one at a time and infuse that in a bottle of water and transport that around, as well as different teas. There's a lot of herbal teas that have these ingredients as well.
Question about headaches. I get headaches when I have nausea. Could you suggest how to manage these headaches?
I can go first because we probably all have ideas. My first thought is making sure you're well hydrated. So that would be one thing, but say you are well hydrated, what else can we do? It's important to also remember that Zofran, which is used for anti-nausea, can have a side effect of headache. So sort of keep that in the back of your mind. It doesn't happen too often, but sometimes patients can really be affected by that. But say, rule that out. If that's not the case, then I would actually recommend another point. I can briefly just show you, this is a wonderful point on the hand for headaches. So this is the command point for the head. It's large intestine 4, and it's between the thumb and the index finger. And it's, if you sort of just massage and you sort of, I usually just sort of like pinch in midway. And that's another point you could hold for 2 to 3 minutes. This point usually has a lot of activity for patients when we put a pin in, when we're doing acupuncture. A lot of times they can feel the chi at that point. So I find with this point, again, supporting underneath with the thumb and creating a nice connection there, mild to moderate pressure, circular motion, and you can hold that point or do the circular, but this can be really helpful for headaches.
And just to follow that up, I think I'll just reiterate how important hydration is. I mean, making sure you're getting enough fluid, and it's mainly non-caffeinated fluids. I know a lot of us have a knack of drinking a lot of coffee and caffeinated beverages throughout the day, but just really trying to focus on water or other like non-caffeinated teas, herbal teas, just making sure you're getting enough fluid throughout the day.
And just, sorry, Devin.
I
always have to kind of preface everything also with let your provider know, because, if it's something that's persisting or if it's new or any changes, we like to know, as an oncology nurse, we love information. We want to hear what's going on. We want to see how you're doing. We anticipate we have to tweak things as you go through your treatment. So a lot of information from you, it can be very helpful for us to give you the best care and figure out what's going on. So
Thank you for that. Should you avoid acupressure in the arm if there's a port in your bicep all the time? Or should we avoid acupressure only when the port is being accessed?
Right. So if you have a medi port up here in the bicep, I would not do acupressure on that arm. I would just do it on the opposite arm that does not have the medi port. It's probably, we're doing a point further down on the arm, but I think just to be extra cautious, it's especially if it's accessed, I definitely wouldn't. And I think just even if it's not accessed, you have another arm. So I would just maintain doing your acupressure on the arm that doesn't have the implanted port. Did I answer the full question with that, Devin? Okay.
Yes, it looks like it. So we have another few minutes if there are any additional questions. And I'm also putting, again, the direct link to the nutrition website in the chat box, which is massgeneral.org complementary.org/cancer/nutrition, where you can find some helpful tips and recipes for nausea as well as other symptoms. Now. Are there any recommendations for loss of taste and any tips for severe diarrhea?
Well, for loss of taste, it depends on if there are certain foods that do still taste good or if it's a complete loss of taste. There are a lot of different, each individual can have different heightened sensitivities of foods. Like some people have really heightened taste of salt. Some people can't taste anything. Some people can taste sour. It really depends on what you're currently tasting with the strategies. I would actually recommend asking your provider for a referral for one of us, just so we can really take a deep dive for what you're eating and what you're able to taste, and then we can provide specific recommendations and strategies for you.
And Sam and I are doing another presentation on diarrhea and constipation, so that might be a good one to tune into about the diarrhea.
And again, with a severe symptom, the first thought is let your provider know. And if it's something they're actively trying to manage, I think, like Meg said, looking for more information. The brat diet can be really helpful. I know that you guys will probably be talking a lot about that with bread, rice, applesauce, toast for diarrhea. But I think trying to understand the severity of it with your provider is really important. There's definitely some immunotherapy drugs that can cause a lot of GI distress. So I think trying to understand first what the cause is, and then we can sort of plug in some of the interventions.
Thank you, everyone. And as Megan just mentioned, we do have some upcoming sessions as part of this ongoing series. And here are the upcoming dates and topics. Again, these sessions, if you have to miss any, they will be recorded and posted to our website, and you can register at the link here. And lastly, just want to say thank you to everyone for joining tonight, and thank you to our speakers. Do you have any last words, anyone, before we end tonight?
Thank you for having us. This is fun.
Yes, thank you everyone for attending tonight's webinar.
Thank you again, everyone. Enjoy the rest of your evening.